What you would do initially, you would be seen by one of our clinical consultants and you would have a conversation around the treatment that would be more suitable for your cancer. So that you would be given options, and if you chose that you would have radiotherapy, then you would kind of start within the pathway. Potentially you would have a nurse specialist assigned to you depending upon the type of cancer that you had.
There's a bit of an information vacuum when patients first come to see us, so we have to talk about the treatment options but also prognosis. That can be very difficult because we can't always be precise, so there's all that aspect to it, and they are often quite distressed, so it's being able to be sympathetic and compassionate to them, and listening to concerns, but also then being able to explain quite a lot of heavy information, because if it's a complex treatment process, you've got to put that into layman's terms, what it means to have chemotherapy, what it means to have radiotherapy, so whether it's drug treatment or X-ray treatment, as I would say, and take them through that process. So yeah, the first consultation for a new patient tends to be the longest one. Sometimes we'll take half an hour, 45 minutes to see a patient and go through everything. So they take quite a long time to see, and they need that time.
After you'd been seeing your consultant, you'd come and see us if you needed a mask making or some other kind of immobilisation device, and you'd meet our team, which is a small team of 3. We'd go through absolutely everything with you, what type of immobilisation equipment we were going to make for you, exactly how we were going to make it and why it was needed. Because some people are a little bit nervous coming in if they hear something like you have to wear a mask. They're not sure what to expect, so we go through absolutely everything with them and show them our example ones, let them have a feel of it, and we go at the person's own pace. And the appointments, depending on what type of equipment you need making, can either be a quick 10-minute appointment, or sometimes we have to make a more complex mask, and that can take up to about 2 to 3 hours.
There we go. You okay? How are you doing there? You okay?
Quite nice, huh?
A lot of people say that.
I'm a permanent member of the pre-treatment team, and my role really is to plan the patient's treatment, figure out how we're going to treat them, and prepare the patients for radiotherapy, really. So my job is really, the patients come in, they're quite nervous, we're kind of generally their first port of call once they've seen the consultant in a different hospital or in our hospital. So what we do is we do a CT scan or an MRI scan in the position that the patient's going to have the radiotherapy in. We need to make sure that the patient is in a position that's reproducible, and we need to make sure that the setup that we're going to use for the radiotherapy can be accurate every day. Our job is really to put the patients at ease, explain the procedure, what's going to happen. We talk about the treatment and what the future pathway is going to be, and try and reassure them really that we're going to look after them and make sure that they're going to have a good care while they're with us.
We do a lot of the back work behind radiotherapy, so where the consultants come in and they draw essentially where they want us to treat, and then we use complex computer programs and maths to figure out how the treatment unit are going to then do that and spare everything around it.
So our role is a scientific support service, and that can be responding to on-set queries or day-to-day kind of queries and problems, but around that it's looking at developing and improving services, yeah. That work is all going on behind the scenes, but because we don't have that direct patient contact, people often aren't aware of that whole aspect of their treatment provision that's there. And I think perhaps if people were more aware of what was going on, they would feel reassured that actually someone is maintaining the equipment, there is a program looking at it, people are dedicated to trying to bring the latest treatment techniques to our patient population. So I think if I was a patient, I would definitely prefer to know that this was happening.
We talk to the patient, reassure them what's going to happen, talk them through the treatment, talk them through the side effects, give them the opportunity to ask any questions as well. That's really important that they have, if they have any questions, that they have the opportunity to ask us in a safe environment. And we take as much time as is needed. There's no kind of rushing them through. My job basically is to take them through, and then we give them the treatment, set them up in the room, talk them through as we're doing it, so they know exactly what's happening each step of the way. And then once we leave the room, we give them the treatment, and they're in and out the room within 10 to 15 minutes, and of that only 2 or 3 minutes of the machine is actually giving radiation. When they come for the first treatment, they're still very anxious, especially when they think about radiation and you know what that involves, and they see things on TV and sort of Google things, and they're quite quite scared. So we talk through, before they even go in the room, we talk through what the treatment's about, you know, and how we sort of look after them, you know, how we reassure them that there's not going to be any pain involved, you know, and it's very quick, and that we're available literally seconds away if they need us for anything, because patients are always very anxious after the first and second treatment and tend to settle down and calm down. But our main job on the first day is to kind of reassure them and let them know that we are here there, and you know, if they need us for anything, we're available for them.
We're incredibly proud of the service we provide at James Cook for the whole region of Teesside and beyond. We serve about a 1.1 million population, and one of the great things about working here is we've all got a common purpose. We want to deliver those gold standards of practice. From the radiotherapy point of view, we've got all the latest equipment. We have been ahead of the game compared to lots of other centres in terms of adopting new techniques, and we've got a really good working relationship between all of the staff, and that's really important. The other healthcare professionals, nurses, radiographers, healthcare assistants, porters, cleaners, it's all really important, and we've got that real sort of family atmosphere here. We just want to do our best for people, and as I've said before, you know, imagine every patient being a family member, and if you do that, then you will come together as a team and you know, work to do your very best for people, and that's how it works.